Welcome to No Place Like Home, a show dedicated to transforming lives through the power of safe, affordable housing and holistic support. At ASD, we believe that everyone deserves more than just a place to live. They deserve a home that offers opportunity, healing, and a brighter future. For those at risk, especially communities affected by HIV, we're not just providing shelter, we're offering stability, health resources, and a chance to thrive. To join us as we bring you powerful stories of change, resilience, and hope from those whose lives are being reshaped through ASD's commitment to building stronger, healthier communities. This is more than housing. This is a place where lives are changed. ASD, a home for life.
Hello and welcome back to There's No Place Like Home, ASD's podcast. I am your host, Traswell C, Livingston III, President and CEO of ASD, a home for life. Today I have a very, very, very special guest, State of Texas Senator Royce West. Needs for no introduction, but State Senator Royce West, thank you so much for being here.
Traz, it's a pleasure being here with you and the organization.
So before I get into some of the heavy, hard-hitting conversations, I wanted to ask you what music you're listening to right now. What's kind of on your what's your podcast, your Apple Music kind of vibe that you like to relax and listen to?
Now, you know, I'm old school. I'm smooth jazz.
Smooth jazz.
Okay. But I'm also still Luther Vandross.
Okay, and I noticed you brought that Barry White baritone down to when you said it.
And oftentimes I listen to Barry White. Exactly. Okay.
Well, thank you. No, so I do want to say, or just ask, for you to kind of share with us what really got you, what drives you, what got you into public service. I know you're we're in the legal profession for years and defending so many folks, but what got you into public service?
Now, let me say this, I'm still in the legal profession.
Okay.
I still have a law firm. We've got about 12 lawyers throughout the entire state of Texas, so we still do that. Public service. I mean, ever since Pearl C. Anderson Junior High School, the 7th grade, I recognized through a teacher by the name of Gloria White, who was my government teacher, okay, what the virtues are of public service. And since the 7th grade, I've always wanted to make certain that I was able to help other people out. It manifested itself in me getting a bachelor's degree and a master's degree in sociology. I'd often thought I was going to be a social worker. I'm kind of a social worker right now. So that's kind of the beginning of it and what's brought me to this point.
Well, interesting. That maybe that helps me understand a little bit what gravitates me to you. My background is in social work as well, and of course we have our beloved fraternity, Omega Psi Phi. I thought you were going to say Atomic Dog, but I guess that's a little bit too crunked up for the smooth jazz. But at ASD, one of the things that we believe is that housing is healthcare.
Right.
We believe that in Texas, in America, period, you need an individual, a family needs stable housing to maintain their health. Talk to me a little bit about your mindset and what your perspective is on how health care is impacted by housing.
Well, I mean, here's the deal. You're looking at a man that's 72 years old, okay, and spent part of his life in Fraser Courts Projects. If you don't know where that is, in East Dallas. I lived at 4968 Hatcher Place. And a lot of good friends that grew up there that ended up doing quite well. And the deal is this, is that when we begin to equate or correlate poverty and housing and healthcare, all of them correlate, bottom line. And you can kind of look at the different statistical analysis and see that. And so from that vantage point, we've got to make certain that we offer substantial housing opportunities to people who are in need of, who have healthcare challenges, and needless to say, are stricken with that bad disease of poverty.
Right, and we all know there is a affordable housing crisis here in America, but specifically in Dallas, southern Dallas. Talk to me about some of the things, at least that you think you've been proud of trying to get and push against that disparity of affordable housing in the state.
But first of all, let's make sure we recognize that by the year 2040, there'll be over 50 million people in the state of Texas. And affordable housing is one of the prime issues that we've got to tackle as we go forward. You know, we're seeing people being forced out of the city, increases in rent, increases in the cost of housing, et cetera, et cetera. And so have always been working with making certain we have programs that exist to help first-time home buyers, making certain that not only first-time home buyers are able to get support through banks. You know, when banking institutions, financial institutions come to us oftentimes and ask for assistance. Of course, we want to make certain that we have financial institutions that are financially solvent and are able to have the ability to do business. But they're going to do business. They've got to do business with my constituents too. So they can't come to me and ask for legislative support without them giving me their scorecard, so to speak, as relates to providing financial assistance and in terms of loans and different other types of financial literacy programs to people that need housing.
So speaking of housing, I think one of the things you mentioned as far as the homeownership opportunities, as well as the influx of the new population coming to the state, specifically Dallas. Dallas also ranks highest, one of the highest cities in the state on homelessness, and the disparity shows that over 59% of the homeless in Dallas are African American people, and even of that percentage, a majority of those are African American men.
Right.
So when you talk about home ownership and just some of the other opportunities, there are some other barriers that have caused that homelessness. Is there anything you can talk about as far as pathways from that kind of homelessness situation crisis that we're talking about into getting into some of the stability with housing?
Well, I mean, some of it in great part in terms of the problems with homelessness is mental health. And so we've got to make certain that we do a better job in mental health. It never ceases to amaze me that, you know, we always talk about mental health issues as it relates to these school shootings and other issues like that, and also homelessness. But yet and still, we're not putting the resources behind it. Now, we will spend $500 million to set up a fund for energy, which we need to, but we don't prioritize issues concerning mental health and also homelessness. We will pass a bill that says that cities can't have certain types of programs that help with homelessness if it violates state law. But again, we're not putting the resources in. We will turn around and sit up and say that mental health is an issue, but yet and still we won't provide monies in order to get more people into the profession by giving them loan forgiveness. I may have gone a little bit too far on that because I experienced that yesterday.
We will be right back.
I had my own salon as a hairstylist in Addison for 26 years. I became homeless because I had health issues that I could not address while I was working. I was scraped up by ASD. I was bedridden for the first year. I could hardly get out of bed, but I was fed. I had a roof over my head.
ASD is amazing. Like, they literally saved my life. They're very comforting and loving and caring. They're kind people. And I just love ASD. They mean everything to me, and I don't want to leave them, but if I have to, I will. But I just appreciate everything that ASD has done for me and my son.
Yeah, there's so many things that you gave an example to of things that we're just not prioritizing. As far as moving the difference, what are some things that providers, organizations in the community serving those populations, whether it's home ownership or the homeless services, what are some of the things that those providers can do to kind of prioritize or help that prioritization?
It's real important. I'm smart enough to know that I don't know everything, okay? So it's real important in this space that I hear from organizations like yours that give me 1, 2, 3, 3 priorities, and then be willing not only here locally, but on a statewide basis and a national basis in order to help me to do what I need to do as a state senator in order to effectuate getting those programs put in place. It's real important that everyone understands that you got to have a collaboration between your federal people, your state people, your county people, and your local people, and your advocate organizations such as this. And if we continue to put together those types of collaborations, and then get 2 or 3 priorities, and all of us work with laser focus on getting those in place, more likely than not, we will get it done.
Okay, and I think specifically, there have been some ongoing discussions or advocacy with a couple of bills going on right now, being proposed, one tied to shelters and navigation support services in urban communities, specifically within a certain proximity of schools. And I think the advocacy is understandable as far as trying to continue those services. And then from the legislative standpoint, it seems that it's being pushed as a safety precaution. So can you speak to, I guess, kind of these so-called competing priorities on the bill and people that are saying don't do this law?
Well, here's the situation. The question is whether or not the advocacy centers need to be within a specific geographical area of the schools. That's the issue. And what invariably happens is that children on the way to school are exposed, literally, not only to the issues associated with mental illness and homelessness, but persons may very well expose themselves. And do we want our children exposed to that? No, we don't. I know you don't want your children exposed to it. I don't want my grandchildren exposed to it. And so the question is, how do you make certain that we continue to provide the services that are much needed, but just as we did years ago as it relates to liquor, not have those types of services where those individuals are exposing themselves in proximity to the schools. Now, that's not saying all services, but we've got to pick and choose which services would lend themselves to being in proximity to schools.
Yeah, and I think, so that's a great, thank you for that. I think some of the advocates would say, well, why not just enforce rules and regulations, laws against that, whether it's indecent exposure, if you will, or just some of the illegal activities in that proximity as opposed to just shutting down the entire facilities.
Well, this is what I'd say to that. If indeed you have a history of individuals within that specific program exposing themselves or doing things that we wouldn't want our children exposed to, then you need to shut that down and get it relocated. And you should, when you say shut it down, you're not shutting it down, you're relocating the program. I don't want my children exposed to that. And if you have a history of doing that, then the program needs to be relocated.
And so on another subject, talking specifically to Dallas, because I think Dallas has seemed to have traditionally homeless services in certain parts of the town. Traditionally, right. Are you're not necessarily associating that particular case with the operations here locally? That's more of a isolated cases wherever those cases in Austin, I think, is specifically right. Where those came about.
Right, that's exactly right.
Okay. Well, let's talk a little bit about as your constituents and our audience can hear some of the things that you're looking forward to for 2020-25 as it relates to legislator.
Well, this is what I'd ask each and every one of you to do. The fact is that I'm in a fight with one arm tied behind my back. What do I mean by that? I don't have the necessary power in order to get done the things that I think need to be done. And that's because people are not voting. And if they are voting, they're not voting their interests. Or maybe they are. And the reality is the interest is one that's being developed and supported by Republican platforms. I don't think so. Their priorities: education, health and human services, housing, criminal justice. Do you realize that many of you may not even be following the criminal justice priorities in the state legislature, you need to look at some of the bills that are being considered. Now, we've got to support our police officers, but we've got to make certain that we protect citizens against overzealous police activities, and there are bills that are allowing more behavior outside the box, so to speak, for police officers. We've got to make certain that we provide opportunities for our police officers to get a pension. That's a big issue. Police officers, law enforcement, first responders give their all in all, but they're not getting the ability on a long-term basis in order to get a substantial and sustainable pension, those issues. Higher education. Again, the University of North Texas at Dallas, as an example. We got to continue to build that university, being the only university, public university in the city of Dallas. Yeah, I can go on in terms of issues concerning environmental issues, energy. We've got to have and look at making certain that we have a grid, an energy grid that's going to last us well into the future. Because Texas has its own energy grid here, and we've got to make sure we balance getting that energy with environmental issues.
Thank you, Senator West, and thank you to our guests. I think the bottom line is we need to get out and express our vote, get aware of the issues that we are dealing with in our state or in your community, and find a way to advocate for your best interest as well as the broader community, but be active nonetheless. I want to pause here and just say thank you to Senator West for being here. I want to invite each and every one of you to go to our website and follow us on asd.home.org. But as far as HIV, ending the HIV epidemic, U equals U, follow us on all platforms, social media, as well as asdhome.org. Thank you.